Content warning. This podcast episode contains discussions of a sensitive nature, including deceased organ donation, that may be triggering for some individuals.
5, 4, 3, 2, 1. Let's go. Diary of a Kidney Warrior podcast in partnership with Kidney Care UK, sharing faith, knowledge, hope, and love.
Hi, and welcome to Diary of a Kidney Warrior podcast. My name is Dee Moore, and I am a kidney warrior. This podcast is dedicated to encourage, educate, and inspire as we explore all aspects of kidney disease, related chronic illnesses, and health. If you have any questions or ideas for topics you would like me to cover, please get in contact with me on social media using the handle Diary of a Kidney Warrior. My guest today from Nottingham, England, is specialist renal clinical psychologist, Dr. Emma Coyne. Dr. Emma joins me for the first in a two-part series where we look at the role of psychologists in helping kidney patients navigate the kidney transplant process. Today, in part 1, we discuss preparation for transplantation, bridging the medical and psychological. Hi, and welcome back to Diary of a Kidney Warrior podcast. How are you doing today, Dr. Emma?
Oh, brilliant. Thank you. Thank you so much for asking me again to come and talk to you.
You're very welcome. Listeners, for those who haven't yet listened to our previous episode, please do check out episode 62, which is titled Chronic Illness, Grieving the Self. It was an amazing interview, learned so much, and that helped me personally. And so I know very much so it will also help you guys out there. So yes, please do check out our first interview together, and that's episode 62. Now, as you heard in the introduction of the podcast, today is going to be part 1 of a 2-part interview. We're going to be looking at the psychological side of transplantation. So in part 1 today, it is titled Preparation for Transplantation, Bridging the Medical and Psychological. And so I'm really excited about doing this subject because, as everyone knows, I'm on the transplant list myself. So I definitely have a personal interest in this subject. And so I'm really excited to learn more and, to start this interview. So I'm going to start with my first question, and I'm going to start with the basics, really. And my first question is, does a psychologist see everyone that's going to have a transplant?
Do you know, if we had lots and lots of psychosocial professionals working in renal, and we had every unit had professionals working there, then in an ideal world, we would see everybody to give everyone some help and support to think around what it's like to have a transplant. But unfortunately, not every unit's got access to these type of support professionals. And where units do have them, we tend to only see certain particular people who perhaps have been identified as needing a bit of extra support or help to get them ready for transplantation.
What type of people who would need that extra bit of help?
So I could answer that, and I probably will in a moment, by telling you all the different types of groups of people that might end up seeing a psychologist. But I guess the first thing I'd say, it's quite individual, and often it will be the doctors and nurses in the renal unit who identify that somebody has an additional need. That means that they get referred to see a psychologist. But the NICE guidelines have actually identified particular groups of patients that should get this extra help and support prior to having a transplant. If people have had a particular history of significant mental health issues, then it could be quite important to see if they're in the right place psychologically to be on the transplant list and to have a transplant. It might be that people have got some other difficulties going on in their life, like, for example, substance misuse, such as people who are struggling with drug or alcohol problems. People might have some form of cognitive impairment. So for example, that could be somebody might have a developmental intellectual disability that might impact on them understanding about transplantation. Or, for example, it could also mean that in older adults, they might have some cognitive impairment or memory difficulties that might impact on their ability to look after themselves after a transplant. They might be just struggling generally with managing their treatment. So, for example, not coming to appointments, not taking their tablets regularly, and if they're doing dialysis treatment, maybe not doing the treatment as their doctors and nurses would like them to. And those people, we'd like to make sure that they've got all the help and support possible so that they've got the best chance of making the transplant work for as long as possible. It's also been identified that people who have low social support tend to find having a transplant more difficult. One of the key things is having a good support network around you so that people around you can help you to look after yourself with a transplant. So sometimes people who are very isolated and don't have that support, they might benefit from thinking a little bit more about how they're going to support themselves after a transplant. I guess the other group of people that do often get referred to see a psychologist are people who've maybe already had a transplant and that they've really struggled to support themselves with that transplant. They might have lost that transplant earlier than expected. They might have struggled to take their medication. So they might struggle to come to appointments as often as they need to. And that might have led to them only having the transplant for a shorter amount of time. And so that's quite a big decision about whether we should enable them to go back onto the transplant list and have another kidney transplant. I'm all for finding support for people to find ways to maybe change how they are managing themselves and their health to give them the opportunity to have a further transplant, if that's what they want. But it is a decision where it is something that, as a psychologist, it can be a little bit different because we're involved in making that decision. It's not just about providing support, but it's also about making some recommendations to the team about what might be needed to enable that person to have the best chance of having a really good outcome with their next transplant. There's also people who have a diagnosis of some type of neurodiversity or neurodivergence, such as autism or ADHD. They can also really benefit from having some extra support just to think about how they're going to manage their transplant and to make sure that they completely understand what the expectations will be once they have a transplant.
So there's a wide range of different groups and types of people that you've mentioned, a lot of different issues and challenges that they have to face. So where would you start? Where would you begin to work with a person?
So I guess the first thing that I always start with is finding out about how much the person knows about their own kidney failure, because often people don't really understand why they need a transplant in the first place. And so just making sure that people understand how their health has come to the point that they're being recommended a transplant, that's really important. I guess the second thing is helping people to understand what a transplant involves and really how the transplant system works. Transplant teams are really good at trying to prepare people for transplant, getting them to watch information videos or attend group meetings to find out about transplant before they then might meet the surgeon to look and whether they're now ready to go on the transplant list. But it's quite interesting because actually, when I talk to people, a lot of the time, people haven't taken in that information, often because it's quite shocking and scary and overwhelming, that they're getting all of this information and they just don't take it in. And of course, if you've got any form of additional needs or barriers, then it's going to be even more difficult to take that information in. So really checking out that they've understood that process and their expectations around transplantation.
That really makes sense starting from there, because that's something I've often talked about, that when people say, I wasn't told, no one told me X, no one told me Y, no one told me Z, I think it really is and goes back to what you were saying about when they were told, they weren't in a position to process the information and take it in because they were dealing with so many emotions at that exact same time. And it's like, for example, when I was told that my kidneys were failing, what I heard was, you're going to die. No, that's not what the doctor said, but that's what I heard. Because as far as I was concerned, kidney disease, death, it was synonymous. And so whatever I was told at that time, I can't even tell you what I was told after he said that statement. So the fact is, even now, I don't even remember what was said because I was dealing with my own battle, really, of dealing with this diagnosis and everything that was going on in that moment. So it makes sense that you would then revisit this. How do you then move forward then once you've gone back to their understanding of the process and explained to them about kidney disease and what it means to need a transplant? What's the next step?
You are absolutely completely right, because so many people that I see who perhaps had a previous transplant that hasn't lasted very long or not as long as we would have expected, often they will be referred through and the team will say, we think they weren't taking the medication properly. And I will often sit down with them and say, can you tell me about your last transplant and why did you only have a transplant this length of time? And they will then say, oh yeah, but I did take my medication. And I always then unpick that a little bit further. And we often find that what they've heard is that they should take their medication morning and evening, but they didn't hear or really understand that morning and evening isn't 12 hours apart. Some of the transplant medication can often be prescribed where you have to take it 12 hours apart. And so actually people were quite haphazard about that. So if they got up late in the morning, they'd been out for the night before and had a lay in, they'd take the medication at lunchtime and then they'd still take their evening dose at the normal time. Or they might say, oh, well, if I missed a dose here and there, it wouldn't matter. And actually in their head, they are thinking that they were following the rules and it hadn't occurred to them that what they were doing was having an impact because they hadn't truly understood how important it was to follow the information about the medication so exactly.
For me, knowledge is power, and that is what this podcast is about. And hopefully, one of the things that I want this podcast to do is bridge that gap between the health professional giving you information and you really being able to process it and apply it to your own care. Because I really think that you have to be your own health manager. You have to stay on top of it because you are the only common denominator in every medical visit. You are the only one that's at every single one. The more you know, the better you'll do. And simple things, and it seems simple, but understanding the implication of taking medication at different times, the impact that it can have on your kidney can have colossal results if it means that that kidney fails as a result of it. So I definitely think that the more awareness that is brought and spending that time to build understanding is key and is crucial. In terms of, again, the different groups that you work with, I mean, how long would you be preparing somebody ahead of transplant? And I know that obviously people are on the transplant list for different lengths of time, and we don't know when the kidney is going to come through if it's a deceased donation. But in terms of a living donor, when you have a planned date, and so you know exactly when the date is coming up, would you prepare them differently, living donor versus deceased donor, or doesn't it make a difference? It's just about the individual. I mean, how does it work?
I think it is really individual. I mean, I think the first thing is for someone to be getting ready for transplant is they have to be medically fit for transplant. So there will be people who aren't medically fit and then they become medically fit and there may be some of these issues. And I'm like the next step in their transplant preparation process. But also maybe there are some people who are quite far away from having a transplant. Maybe they're really struggling with taking their tablets or attending dialysis. So they may not be ready for workup for transplant, but they may be referred to see somebody like me. It might be at some units, that might be a counsellor or another sort of psychosocial professional to give them some support to get them ready for transplant. We would want to see somebody and work with them so that at the point at which I say, I think this person's ready for transplant, we've done all that preparation work. And I guess it doesn't necessarily stop at the point somebody goes on the list, because then they may need some further support to keep on top of maybe if they've had to change some behaviours. So, for example, if somebody isn't taking their medication, we might work a plan to try and help them manage that and start to take their medication. What we know is the best predictor of how well somebody's going to do, say, with medication, is how they've done previously and how they're doing now. In the past, somebody hasn't taken the medication very well. If we give them a transplant, there is an increased likelihood they're also not going to take the medication very well. Then the best thing we can do is try and make some changes now and make those changes long enough that they become their new way of managing themselves. And that increases the chance that that will continue over when they have a transplant and that they'll be able to look after it. So I guess it's very individual. Clearly, if somebody has a living donor available, then we've got a more clearer idea of the time scale that we are working to. But I guess the same thing applies. It's about being able to say that this person is ready to be able to cope with the demands that a transplant's going to bring to them.
So let's talk a bit about that, the actual demands that having a transplant is going to place on someone. So now you mentioned about the responsibility of taking their medication at set intervals to keep the kidney safe. What other types of demands would be on an individual when they're preparing for a transplant that they need to be aware of?
It's a really interesting one, because however much people say to somebody, a transplant is not a cure, people want it to be a cure. They want to go back to the life they had prior to their kidney failure happening. And so it's really important that people realise that having a transplant is like having a different form of treatment for their kidney failure. And just like if you're on dialysis, you have to do a certain amount of treatment every day or every week, there are still requirements and expectations of you after you have a transplant. So, as you said, taking medication is the real biggie. But there are other things that are really important for people to take into mind. That there's an awful lot of contact with the hospital immediately after a transplant. You often are attending appointments initially 3 times or twice a week, and that will decrease over time so that eventually, when everything's going well and hopefully going well and stable, you're only going to be coming to the hospital a few times a year. But actually, if you miss those appointments, that might have been the opportunity to do the blood tests. Those blood tests are the opportunity to find out how well things are going and to pick up on early warning signs of problems. So one of the key things people are signing up to is that they're not just going to take the tablets, but they're also going to keep coming to all their appointments and keeping in regular contact with the hospital. I guess one of the other things is recognizing that when you take the tablets, what those tablets are doing is they are suppressing your immune system. I always find that's a really interesting concept. We talk about anti-rejection medication or immunosuppressants. It's another thing that I talk about a lot in transplant preparation, helping people really understand what that means, because it can be quite hard to understand what that means for people and why it's important to take their medication on time, and also that means that they are going to have an increased risk of infection. And if they get poorly, it's really important that they might make contact with their renal unit early, particularly because if you're really poorly, you're being sick and you're vomiting, you might not be keeping that medication down. And that then will have consequences. So asking for help and recognizing you might need to seek help early is really important. And is making sure that you're really hydrated. You know, it's one of the really funny things that happens is that most people, and you might say the same thing now, is that we talk about some of the problems people have post-transplant. Sometimes post-transplant people have a problem drinking enough fluid. And you're nodding at me and you're laughing.
A lot of interviews that I've done, people have said that they had to get used to drinking again because they had such a big fluid restriction. And then now they have to drink litres and litres of water and they really struggle to do it.
Yeah, absolutely. I always talk about the need to drink more post-transplant. And I would say 10 out of 10 times, people will say, that won't be a problem. I can't wait to be able to drink again. But I think it can be difficult because it's such a change, particularly if people have had a really tight fluid restriction before. And there's just so many changes at once. It's adjusting to new tablets, new medication regime, different appointments with different people, because you will have been going to, say, the dialysis unit if you're on dialysis, or you'll have a home dialysis team if you're at home, or, you know, you might just have been coming into the sort of free dialysis care if you hadn't started dialysis yet. And you've got a relationship with those teams, and suddenly you've got a whole new set of doctors and nurses also supporting you. So many changes at once. It's quite a lot to get your head round.
One of the things that I'm very aware of, because as everyone knows, I'm in this position myself, is actually the wait itself for the kidney, because it's not like you get like an update on your phone, a notification that says you're number 1,227 on the kidney transplant list. You don't get anything. There's no indication. There's no nothing. You just literally 24 hours a day, 7 days a week, have to have your phone ready because you could get a call anytime. How do you prepare people to cope with that, the uncertainty of the wait and not knowing when you're going to get the call?
I think it's really challenging. And I think knowing how the transplant list works and how many different factors are taken into account as to what would come to a decision to call you is helpful, because I think then you've got that information. And actually, I encourage people to have conversations with their transplant team about, you know, what the team think about what their likely expected wait will be, because I think that helps manage somebody's expectations. You know, we know from some of the testing that we do we can indicate whether somebody is likely to be a more difficult person to match for a transplant and likely to have a slightly longer wait. And I think that awareness is a useful thing. And I think people cope in many different ways. So some people cope by not thinking about it, almost a form of denial. It's not true denial because they know they're on the list, but actually you can't live your life thinking every minute of every day is the call going to come. And actually, if you end up sort of being that much on call that you're constantly checking your phone and consciously anxious about it, it may be that's a sign that you might need some extra support just to manage that if it's having so much of an impact on your everyday life. One of the things I often suggest people to do is to write a transplant list. So what I mean by that is a packing list of what you would take to the hospital should the call come. Because some people will pack a bag. I don't know whether you've packed a bag, Dee, in preparation, but some people get a bag packed and that's fine. But actually, there's not a lot of things that you can put in your bag because a lot of the things you need are things you use in everyday life, like your phone charger, and it may be that some of the things people want to take with them are quite personal to them. Like sometimes people will take a pillow in with them or a blanket that they're using normally in everyday life as something to comfort themselves. So having a list in advance of what you need, because in my experience, however prepared you are, when the call comes, it's a bit of a shock. And often we know when we get a shock that your brain doesn't always function particularly well. And it can be quite hard to think, what do I need to do? So it's really good to have a really good plan, which involves, okay, if the call comes, who am I going to ring and who's going to support me? So who's going to come round and help me pack the bag and who's going to come to the hospital with me? Who's going to make sure I get there in one piece? Because of course you can't drive to the hospital because you could potentially be going in for surgery. So having a good plan in place about who's going to support you, I think is really, really important and a useful thing to do for preparation.
That's a really good point because I have kind of a bag packed, but it's semi-packed because, like you said, a lot of the things I actually need on a day-to-day basis. So there's things that you can duplicate, like shower gel, things like that. But there are things that you're going to need on the day that, like medication and things like that you can't put in the bag in advance. So I think that's a really good idea, having that plan. So at least if you're not home and someone can pack it in your absence or whatever the case may be, having that list. Yep, I'm going to make my list.
And I guess another thing that I always say to people is it's also really important to listen to what the transplant coordinator or who brings you up to invite you to come in says, because they often give different pieces of information at that point. And they might tell you that actually they will always tell you not to rush. Because one of the things to think about is particularly, and I guess we're talking about in this case, in this scenario, we're talking about a deceased donor, where rather than if it was a living donor, you would know the time you were going in. But with a deceased donor, even though they ring up and say, we've got a donor, I would imagine that the next thing they're going to say is, don't rush to the hospital. And that's because it's all planned out, and it's planned out really well in advance. There has been lots of discussions going on prior to them ringing you. They have been thinking about, right, we've got a kidney offer. Is this the right kidney? And if it is, what time is that kidney likely to be coming to our hospital? And then what's the time do we need to get in touch with the person? And so all of those conversations mean that at the point at which they ring you, this isn't you need to sort of have blue flashing lights and rush to the hospital. You have got a bit of time. And sometimes they will say things to you like, have a light meal before you come in, have some toast, because that is telling you that there might be a bit of a wait when you get to the hospital before things are going to progress and move. Again, what in my experience, people are so surprised because often they, have been waiting a while. Conversely, people are also equally surprised if it happens really quickly, because they often will say, I wasn't expecting it to be so quick. In my head, I was thinking it was going to be 2 to 3 years. So it is one of those things where you're never going to be fully prepared for the time that the call comes. So it's preparing for the fact that it's going to be shocking and making sure you've got lots of support to enable you to get to the hospital, and really focusing on listening to the information that's being given to you when somebody rings up.
The other side to that is, how do you prepare somebody who's got the call and then they've gone to the hospital, they've waited around for X amount of hours, and then they turn around and say, actually, you won't be having the surgery today? How do you prepare somebody for that level of disappointment?
So I think it's really key what you think in your head and what you say to yourself when you get the call. Because I think if you say to yourself, I'm going to the hospital to get a kidney transplant, I think that there is a big chance that you are going to be sad or upset if it doesn't go ahead. It's not unusual for people to go in for a kidney transplant and it not to go ahead. And also, there's also the other scenario, which is where we sometimes will call in more than one person and you're the reserve choice for a kidney transplant. Of course, if you're the reserve choice, you should know that. And that's another thing about why it's really important to listen to what's been said to you. But I often say to people is to think that when a call comes, whether you're a reserve choice or a first choice, is that you're going in for the possibility of a transplant. And actually, the transplant is only definitely going ahead at the point at which they take you down to the operating theatre. There is the possibility that something unexpected along the way crops up that means that transplant isn't going to go ahead for you today. So I do think that expectation and what you say to yourself can make a really big difference. I think for people who come in as reserve choices, often I think it's really helpful to come in and think that already that it's very likely that they'll be going home. But it's useful that they're there, because it means that should for any reason the first person be unable to have the kidney, that kidney can get used. So, that's a positive by being there. But another way to think of it is that means they're a step closer to being the person who gets called in the first place next time round. So actually getting a reserve call is probably a good sign that you are much closer to being the person that gets a call in the future. I think those sorts of thoughts can be really, really helpful to managing those situations. I think one of the worst scenarios for people is often around the type of donor, where people haven't done the research or they haven't understood enough about donation, and they don't understand about the different sorts of donor kidneys and how that might impact on whether a kidney donation goes ahead or not. So there's two different sorts of deceased donor. There's somebody who is donating after a brainstem death, and there's somebody who's donating after a circulatory death. So the first person is attached usually to a life support machine, and that they've confirmed that death has occurred from a neurological criteria, and that in that scenario they pretty much know when the organs are going to be removed for donation. So the timescale's really clear. But in relation to what we call a donation after circulatory death, in that situation, they're going to turn the life support machine off And then when the person passes away, they'll remove the organ. And certainly in my experience, I've seen several people who've been distressed because they've come in for a kidney donation and then the donation hasn't gone ahead. And they've found that really difficult because they hadn't understood the different types of donor, and that with the donation after circulatory death, there might be the scenario where there's been an extended amount of time and they've been unable to progress to organ donation. And that can be quite distressing for people if they're not aware that that might be one of the reasons that a donation doesn't go ahead.
There's a lot to unpack there because there's so much going on for the person that's been called to the hospital. That feeling of, I could get my transplant, this really could happen. And then actually facing the fact that someone actually has died and that is the organ that they're going to receive. How do you prepare somebody for that?
It's really interesting because I think that we generally struggle to talk about death. We use lots of different terminologies. We talk about people passing away. We often find it quite difficult to use the word died or death. And actually, it's really difficult with kidney donation because you've got so many different emotions. People will often say, it's so hard because I am coming to the hospital for a potential new kidney, and people will have a whole range of responses to that. I've seen and talked to people who are so excited, people who are so terrified, people who are so distressed because in that possibility of a new organ, if it's come from a deceased donor, then suddenly those thoughts turn to what's happening with the family of that deceased donor. I think it's really important that we separate the two events. I think a lot of people often get hooked up into this thinking that somehow this person died to give me a new kidney. And actually, the two things are unrelated to each other. The person died. Whatever has happened to them was always going to happen. And that didn't happen so they could donate for you who is receiving that kidney. These awful events happened, and that can be very difficult for the family in that situation. However, what we know is actually that the family being able to agree and support that donation and often follow the person's wishes to donate gives the family lots of comfort, and that they know that the death that was likely to happen, now there is some positive meaning or a gift that comes out of it to help somebody else. So we know that families generally find organ donation to be really comforting for them. So yes, I think the main thing really is recognising that it's two separate processes here at work and not linking those two things. Once they get linked in someone's head, then they get into that type of thinking as well. Should it have gone to someone who deserved it more, or why has it come to me, or, you know. So I think the main thing is that it's trying to make sure that it's seen as two separate events and not linking it between that, somebody died to be able to give me a kidney transplant, because I think that then can set off other thoughts. Potentially later on, people might start thinking, did I really deserve this kidney? Should it have gone to somebody else? And I think it's really important that we see it as two separate events. But as I just said, there are so many different feelings. And I guess the key message here is it's okay to feel all of those feelings. It is okay to be really excited and terrified and sad and upset about the donor. Transplantation and emotions, they're completely intertwined. We can't separate the two from each other.
So the other side to this is living donation. So I have to ask this question. What if you actually start the process of living donation and you get along with the person really well, and then there's kind of like a falling out, or they don't get along, or maybe they never got along in the first place? How would you prepare somebody to receive a kidney from somebody who they didn't actually have that good relationship with?
So that's a really interesting question. So we know that there's really clear evidence that receiving a transplant from a living donor is going to be better for you physically. You're going to have better outcomes and the transplant's likely to last longer. But actually, there is an impact of the psychological issues and we shouldn't overlook it. Some research has shown that if you don't get on with your living donor, then you don't have as good outcomes afterwards. And actually, I think I'm looking at your face when I said that. You might think for a moment, why would that be? But actually, when you're having a living donation, you're accepting a part of someone else's body into your own body. And actually, if you don't like the person that kidney is coming from, it can be then harder to look after yourself and look after the kidney. And that can be quite tricky. So it is important that you have a reasonable relationship with your donor. But I'd also encourage conversations between living donors and recipients before the kidney donation happens, where they have conversation about how is it going to be afterwards. You do get scenarios where somebody has donated and then afterwards they're really anxious or worried about the kidney and they're always checking up on their recipient, and then the recipient finds that sort of intrusive and becomes frustrated by that. So I think it's really important that there's a conversation around how this is going to be managed before you go ahead with a living donor. And in answer to your question around what if you really don't get on with the person, then actually I do wonder whether that's the right decision for you in that situation. And again, that's the type of situation where a psychologist or a counsellor can really be of benefit to help just make that clear in your head, whether this is something that you can work through and overcome, or whether this is an absolute no, this isn't the right thing for you to move forward with.
The reason why I asked that question is somebody might be in a situation where they've gone into kidney failure and a family member has volunteered and they're like, yeah, I'm going to give a kidney. And it might not be somebody who they like or feel close to and feel like, well, they're offering me the gift of life. I have to accept it, but they don't feel close to that person. So it might seem strange of a question to some people listening, like, why would you want to get an organ from somebody you don't like? But at the same time, you want to live. So it's one of those situations. So that's why I asked the question.
You know, I think it's a really important question. They're the sort of things we don't talk about because we get so focused on wanting a kidney, for somebody who's in that situation. It's like, I really want a kidney. And you're sort of moving forward. And it's very easy to get caught up in that whole process and actually having a moment to just check out if this is the right thing for you to do. I think it's really important to have those conversations with the kidney team. Your kidney team's really super experienced with these type of issues and can really support people to think through and work out what the right thing is for them and for the donor as well. Because clearly we've been talking today very much about it, the point of view of the person receiving the kidney, but we're also equally responsible for the psychological well-being of the donor. And it's really important that we've thought through what's right for everybody in this. Clearly, living donation is a really good option, but people do find it difficult. It brings up lots of psychological issues and can really challenge people. And it's important that people have the time to make sure that this is absolutely what they want to do.
So we've looked at the different groups of people that renal psychologists tend to work with. We've looked at different strategies in terms of coping. We've looked at waiting for the call, coping with the wait, drawing up your list, preparing psychologically for when you get the call, what happens next. We've talked about loads of things, actually, and we've covered so many really, really important points. But I just wanted to ask, is there anything else that you would like to add in terms of different things that we need to be aware of in preparation for a transplant?
I think for me, the main three things are, and I guess it's pulling some of the things we've talked about already, but is making sure that you've got really good routines around your medication, using tablet containers, alarm, and getting into those routines before you have a transplant, because that's going to make it so much easier to manage after you have a transplant. I think the second thing is getting lots of information, finding out about how transplant works at your particular hospital, asking lots of questions so you understand what's going to happen, so that you know that, for example, when you come to the hospital, all the different tests that are going to happen at that point, and actually you're going to be waiting many hours before you go down to the operating theatre. If you're prepared for that, then you're going to cope with it much better. So in this case, information is absolutely your friend. And even though it can be a bit scary, finding out that information will help you cope with it. And I guess the third thing is, particularly if you're likely going to have a deceased donor, is just thinking through that, thinking about what it will be like to welcome a new kidney into your life. And, it's really interesting because quite a lot of people end up naming their kidneys. There's quite a few Sydneys out there.
Sydney the kidney, that's a really cool name. And on that point, that seems to be like the transition from the preparation before transplantation to post-transplantation. So I think this would be a good place to pause. And actually, before we finish the episode, do you have a final word of encouragement for the listeners?
It's really interesting because I met one person who didn't call their new kidney Sydney. They actually called their new kidney Hope. And I think that was a beautiful name for a kidney. And I think that's the way I think about transplantation.
Thank you so much for joining me. Thank you so much for the information and strategies that you shared. I know that this will help so many people. It definitely has helped me. And I'm really looking forward to part 2, where we're going to be looking at post-transplantation, bridging the medical and psychological. So thank you again. Thank you so, so much for joining me. Thank you for listening to Diary of a Kidney Warrior podcast. And don't forget that you can contact me on social media using the handle Diary of a Kidney Warrior. Please do subscribe to the podcast and please do tell a friend. New episodes of this podcast are released every other Monday. Until next time, take care and choose to live.
Diary of a Kidney Warrior, sharing faith, knowledge, hope, and love.